Yes, I believe you can start. Yeah. Do you have any other one from the faculty, Dr. Mahmoud?
That is Dr. Mahmoud will join soon, and Dr. Bassem, I will just forward for him the link. He will join also.
I believe we can start, not to waste our colleague time. So until Dr. Mahmoud and Dr. Mani join, you can start with your presentation, then we will take it forward from there.
Okay. So, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Hayyakum Allah. So, good afternoon, our esteemed colleagues and senior surgeons join us across the globe. Welcome to the Medical International Orientation Masterclass for our 6th deployment of our SCFHS General Surgery Consultant Interview course. So we recognize the profound value of your time, and today, purpose to demystify the professional pathway into the Kingdom of Saudi Arabia regarding our specialty general surgery. The paramedic was founded initially in the United Kingdom, so across an elite of the NHS system, and they could demystify the gap of rate of success, and they could increase the rate from 44% for the international graduates to 86% for the international candidate for the FRCS, also the local candidates. And in our experience that we started on March 2025. Can you stop the mics, please? Thank you. So in our experience, we started this course in March 2025 by doing our first webinar orientation session and start this program by identifying the health system, how to pass the exam, as there was a simulation between how to pass the exam in Saudi Commission and in the FRCS. There is some similarity, and all of that based on 3 points: knowledge, language, and practice. And what we offer in the Prep Medico SCFHS by our mentors, our professors, our esteemed faculty, these key 3 points, but with designated with a high quality of practice, because we believe you are at the level of consultant. So we will try to revise across our program the most important things that you have to know in our lectures, but the knowledge is mainly for the candidates. Also, there is a minimum of language to master the English, which is mandatory to success the exam. But what we offer deeply, this practice through interactive lectures, through sessions of mock viva, and by the end of each course, we have simulation exam, which called mock viva exam. So this year, alhamdulillah, we successfully deployed these systems, and we are profoundly proud to declare across our previous cohorts, our candidates achieved more than 90% or more than 95% of the first attempt success rate. So no setbacks, no repeat fees. Today, we open the architectural blueprint behind those results to you. It is an interrogation of how you think, adapt, and behave under immense stress. Do not approach this panel as a student attempting to memorize textbook. You are not resident, you are not specialist, you are consultant. You are already senior. And the examiner are checking for one of core attribute, which is clinical safety and consultant ownership and behavior, which is extremely important. As you know, under the sweeping mandates of Saudi Vision 2030, which will lead for development of the health sector system and transformation from the ministries of health to autonomous clusters, central, eastern, western. This will give more autonomous, more independence for each cluster system in the recruitment, the hiring of consultants across all the kingdom. Furthermore, you must align your clinical answers with the KSA's modern regularity frameworks. The malpractice insurance is now universally mandatory across all tiers of medical staff. More importantly, a recent national policy shifted to stipulate that overseas candidates must successfully pass their SCFHS consultant evaluation prior to securing an active employment contract or entering to the kingdom. Just this point, I would like to clarify. Before you can come to the kingdom, you can start to work and you can pass the exam or prepare within a couple of months during the first year. But almost last year, it became mandatory in the first interview of hiring to get this exam. Add to that, you cannot have an active insurance of malpractice, medical malpractice, unless you have got this and pass this exam. So now it's mandatory if you want to have this opportunity to work in Saudi Arabia Kingdom to get this exam, success it before coming here. Dr. Ihab would like to add anything?
No, I'm following, taking it nicely and perfectly. Hopefully, our colleagues listening are following what you are saying, because it's very important, very crucial. You want to start your career in Saudi Arabia, in Gulf area. Actually, Saudi Arabia exam is not so different rather than Dubai and UAE exam. It's more or less the same. If you pass through the Saudi Arabia exam, you will easily pass the Dubai exam. So what Dr. Faisal just mentioned is very important. You can never start any kind of work actively in any Gulf area without license, which will start. You can start with Saudi SCFHS license, which will make your pathway very easily. And the market here is very open, and the opportunity and vacancy is extremely a lot. Especially, I'm telling you as an Egyptian, but the market for the North Africa and Arab world is much open rather than Egyptian for the time being. So you have a great opportunity. Once you get the license, you will be caught a vacancy immediately in a very short time. You can continue, Dr. Faisal.
Thank you.
And if anyone have any question while Dr. Faisal is presenting this point, one more clarification, want to ask about anything, just stop him and ask him immediately. Don't be shy. The first important and crucial point to pass this exam, don't be shy. Be confident, but not arrogant. So if you started to speak with us now, you will cross a lot of obstacles to pass this exam, which is lacking confidence and being shy and expressing yourself in English. So if you have any question, just pop up and open your mic and ask it. Don't even raise your hand, just speak. Okay, you can continue with your question.
Okay, Dr. Bassem joined us. So we welcome Dr. Bassem, our senior faculty, and would like to hear from him about his experience. Dr. Bassem Sharif, senior general surgery consultant and traumatologist, assistant professor in the Western region, one of our esteemed faculty. So we would like to hear from him regarding the health system in Saudi Arabia and regarding this experience exam and what the candidates should have in their mind before passing this exam and how to prepare.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm really honored and privileged to be with you guys, and welcome to the sixth version of the medical prep courses. If you can allow me just 5 minutes to get to my office so I can talk to you.
Absolutely. Absolutely.
Yeah, just give me 5 minutes.
Absolutely. Absolutely. Take your time. I will continue once we let me know. Thank you very much. So bless. So we will continue. Who are our faculty? So we started the course with mainly Dr. Manikandan, Program Director of Prep Medico SCFHS and Program Director of Prep Medico FRCS, and Dr. Adel Mahjoub, Senior Consultant. And by this occasion, دعوتكم ليه بالرحمة توفى الله يرحمه من couple of months after a severe accident. So I kept this photo just to remember it because he's one of the founder of this group, ambitious and given an excellent training for all our candidates by their witness. And you will listen from our previous candidates, Dr. Asadullah, Dr. Ahmed, here present with us, also Dr. Anis, about their experience in Prep Medico. There is Dr. Ihab Saad, our prof from Egypt, senior consultant in Saudi Almani Hospital. We have Dr. Basim Sharif already presented, Dr. Haifa Al-Utaybi, the famous consultant who written the study surgery book, which is used by, I believe, by everyone who want to go through this exam. Dr. Turki Shamari, Assistant Professor, Colorectal Surgeon in the Eastern region. Dr. Mahmoud Talat, hepatobiliary surgeon in Egypt, general surgery consultant. He is my friend and my brother, and we are conducting most of the sessions together, and I'm really enjoying that. So these are our esteemed faculty. So you see international group from Saudi Arabia, from Egypt, from Algeria, and to give the best experience that we can with this specificity of international schools, from North America, from Europe, from Africa, from US, and this is very, very rich and nice experience to get through. How we conduct our training. Usually, standard of our program is going through 6 to 7 weeks of training. Every week, we schedule a lecture for 3 hours and then a viva for 3 hours. In the history, the first session was just allocated to vivas. Then second, start from the second course, we adopt the same system in the FRCS, and which lead for an excellent results. So we give a lecture usually on Tuesday between 6 and 9 p.m. KSA. Then we give 2 to 3 days to the candidates to revise, and we do a viva on Friday afternoon, usually in this same time. The advantage of our training is they give an access through video recorded through our LMS. Once subscribed, every lecture, every viva is recorded, and you have multiple options to have access to this library for 3 months or 12 months based on your preferences. So based on the preferences of the faculty, we adapt the program, and this is our program for the 6th course. So today, orientation session with some taste survivor to just show you how things went. Then we will start on, inshallah, July 10th, Friday by hepatobiliary surgery lecture. Then on Tuesday, hepatobiliary surgery viva. Then this week after, breast surgery with Dr. Haifa. Then traumatology with me and Dr. Mahmoud. Then upper GI surgery with Dr. Ihab. Then colorectal surgery with Dr. Ihab and Dr. Turki. then general surgery with Dr. Bassem, and we will finish with endocrine surgery with me and Dr. Mahmoud. By the end of each course, based on your enrolling plan, you will have a mock viva, which is a simulation exam. You will get 1 hour of examination exactly as the exam with 15 to 30 minutes feedback to give the positive points and weak points that you need to work on. Dr. Bassem, I think is ready. We'll be pleased to have you here between us to explain to our colleagues about this prestigious exam. Dr. Bassem, the floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's really an honor, pleasure to be with you guys today. And thank you for Prof. Ihab Saad, who introduced me to the group. Thank you for Dr. Faisal and Dr. Mandi. Basically, I think I overheard Dr. Ihab talking about the health system in here. As you know, guys, now we are going through kind of privatization of the health system. Each hospital or each cluster is becoming independent institution with the hiring and everything. I'll just sign in from my laptop. Yeah, every center is becoming independent institution with their hiring and recruitment. So I think there will be a lot of opportunities. And as Dr. Faisal said, it's not you guys are not resident anymore. You are not a specialist. You are a consultant, and I'm pretty sure that you have in your countries, respected countries, you are practicing medicine. It's just like a way of tuning your skills, a way of getting the license and the certificate in Saudi Arabia. This is the regulations. We are not putting the regulations. We're just applying these regulations. So for the exam, I've been in few exam committees on different levels throughout my career in here. So for the consultant exam, basically they want to test, they will not test your knowledge. They want to test your decision ability. They want to test your speaking language. They want to know if you are familiar with the healthcare system we are in. They want to test definitely as a surgeon your decision ability and capability. So in the exam, they might go through multiple cases during a very short time period. If you didn't go quickly with them, you were up to the pace, you were fast decision maker, this might make you lose point. It's not the decision, like all of us, I'm sure they know, we know how to do gallbladder. All of us knows how to manage trauma cases initially. They want to know that you are a safe surgeon and you are up to the standard of practice in Saudi Arabia, which is not far away from your respected countries. Alhamdulillah, we have a very high success rate over the last 5 courses in medical prep, and everyone gave us a feedback that it wasn't difficult in questioning. It's more of focusing, talking clearly, having the answers ready as if you did it before, and you know when to call for help if needed. I think the distribution of the cases or the distribution of the topics among in the course in here covers all the surgical specialties you might get asked about. The consultant or the instructors are very well oriented with the exams. They have been in different committees in the exam, different level, whether residency or qualification exams after that. And good luck. Welcome, everyone, and hopefully you enjoy our course. Thank you.
Thank you, Dr. Bassem. Thank you very much. This is exactly what Dr. Bassem said, because the examiner, during the exam, they don't know you. Basically, they don't know you and they don't know what are you doing. But based on your answers, they will test your safety. And this is very important, how to express clear answer, stepwise, safe, with clear approaches. Let's say, for example, you have trauma patient. If you will approach random, that will make failing you. If you will approach according to ATLS protocol, following the standard, international standard of care, that means you are updated with the knowledge, you are safe, and you are doing which all the necessary to save your patient. And this is extremely important. Dr. Ihab, would you like to continue?
Yeah, actually, I'm very blessed to have all of these faculty, esteemed faculty with me in this course. I'd like to talk a little bit more about our colleague and our faculty. I believe our candidate or our colleague that planning to have this exam are blessed with this group of people. I'll start with my friend, Dr. Bassem. He's very humble to introduce himself. If you wanted to go through any kind of exam in Saudi Arabia, you need to sit with Dr. Bassem just for 5 minutes. Dr. Bassem, he's a professor. He's taking over most of the exams. I'm talking about the board exam, the SCFHS. Actually, he's planning more of them. Most of them, he's putting down the instruction. He's very systematic and he's very knowledgeable. You know exactly what you need to do in your exam, what you need to express to pass very easily. Myself, as a colleague, Dr. Bassem, I benefit from his existence around me a lot, from the knowledge, from the experience, from the study skills. So I believe you will be all blessed having him for the lecture or the Viva session. Be focused with him. He's one of the best that can guide you to go through this exam very easily. Our colleague and our friend Haifa is very famous by her book. Actually, all of you need to go through this book. It's very important book. This course will not be a substitute for the book. You need to go through the book. So can you imagine if you have the opportunity to have a live session or a lecture review with the writer of the book? Actually, the book was acknowledged by Dr. Bassem and Dr. Turki and a lot of other esteemed professors across Saudi Arabia. So myself, I'm attending Dr. Haifa lecture every course to get benefit from what she's saying, what she's expressing, and what she's explaining. I believe after Haifa lecture in the Viva and the review lectures and the knowledge review lecture, you will not need to learn or study anything about breast anymore. Just focus with her, actively interact with her, and you will get updated knowledge of the breast, generally speaking, and specifically what you need to do in the exam if you face any case of breast. Dr. Mani is not here with us today, but he's the founder of all of his ideas. If I wanted to say something about the idea, it was created by Dr. Faisal himself. Both of us were enrolled in FHS exam. It's a very tough exam. It's an intercollegiate exam, not overseas exam. And it's more or less the same, but it's very difficult. I'm talking about 2 days exam. You will have to take a 12 session, Viva session, and a very long day. So Mani created a group to help people across the world to pass FRCS exam. And from this point, the idea came to Dr. Faisal, why not to start something for SFSH exam to help our colleague to pass it. We know exactly because we all have through all of these quests that you are in nowadays, you are a little bit annoyed about how to pass the exam. You're hearing a lot of people saying that it's very difficult exam to pass and that failure rate is too high. This is not true. The truth is, it's not about the knowledge, it's about how to present yourself. So Dr. Faisal think about this idea. Why not to bring something similar to FR6 exam founded by Prep Medico. Prep Medico is a very international, unique group of educational. They have a lot of liaison and synchronizations with a lot of prestigious college, like the Royal College of Surgeon in UK. Then the idea came from there. And at that moment, I joined, and we started to think about who will be able to give our candidate that will be enrolled with our course the tips and tricks and the piece of information that might help them to pass the exam. Across the five courses, the last 5 courses, the previous courses, alhamdulillah, we achieved a very, very, very good success rate. Even we have some of our colleagues who were trying to pass this exam for twice or triple time, and they couldn't pass it. And once they joined us, they were able to formalize what they need to go through this exam. Last but not least, Dr. Mahmoud and Dr. Faisal, if you sat with them in a viva or in a lecture review, you will find yourself, if you are in exam, exactly. And Dr. Haif, Dr. Faisal, and Dr. Mahmoud have very nice tips and tricks about to pass very easily. In our viva lecture, as Dr. Faisal mentioned, you will have an application and you will be able to have your pass through the application. Through this application, you will find everything about the material, about the lecture review that we are giving, about the viva and the cases, also a lot of other resources, the recorded video that you can, if you are not able to attend a live session, you can go back to the recorded video to revise it at any convenient time from your side. In our viva lecture, we try to collect all the recall cases from the previous exam. So you will find not less than 70% of the case discussed in your specific exam already discussed in your viva lecture. Also, we have Dr. Turki, one of the most eminent colorectal surgeon across the kingdom. He's very talented, and I listened to a couple of his colorectal sessions. He knows exactly what you need to know and what you need to do to go through the exam. If you look at this esteemed faculty of people, actually, I can assure you this: it's not about finance. It's not about getting profit. If I told you the price of 1 hour of every one of them, you will be surprised. Not of the course in their real life. So we are trying just to help. We try to minimize the cost as much as we can to be affordable. It's not about getting a profit at all. As I told you, all of us, if we pay these 6 hours or 7 hours that you are going to spend with you in our job, we will pay a lot of other different payment. So it's purely about to help, and we love to educate people and we love to teach people. So about the exam itself, it's not about the knowledge. We believe that everyone is applying for this exam having the knowledge that they need. That's why in the lecture review, don't expect that we are going to review every topics in the textbook. We will take you through points that you need to be focused on. But what we saw from the previous courses and from the previous candidates, even who failed from the first or second attempt, they have the knowledge. Definitely, they have the knowledge, but they don't know how to present it. They don't know anything about the system and Ministry of Health and what's required from them to be classified as a consultant. What's meant by being a general surgery specialized consultant. You might have a knowledge of how to do GI surgery or hepatobiliary surgery at your back home country, but with the subspecialization and with the strict rule here, you are not allowed to do this. So, but you are asked about a couple or cases from the hepatobiliary, so you need to know exactly what's your limit as a general surgery consultant. The last thing, to be confident, not hesitant, and to be safe, and know what exactly the time that you will ask for help, and the time that you need to refer for another subspecialty or another even center. Having the fluent English is not a big deal. It's not an exam of English. It's not an English exam at all, but you need to express yourself. It's not a big deal at all if you ask the examiner to repeat the question if you didn't understand it, if you express yourself in not a proper language English, but you can tell the examiner what exactly in your mind, to be systematic in your answer, to know exactly what to be said first. It's very important. You might have the solution of the case, but your arrangement and your systematic approach with the case is totally wrong. This what make people fail in this exam. It's not about knowledge at all. So I wish you all best with this team faculty. As I said, most of our colleagues, as Dr. Faisal said, 95 or more, even than 95 passed, even those people who couldn't pass from the first or second attempt. Hopefully you will enjoy the course. Myself, I'll enjoy your company. It will be a mutual exchange of experience. We will present the cases, we'll present the knowledge as much as we can. All what I'm asking from you is to be actively participating in the course. Training how to speak, how to express yourself, how to systematize an answer in your mind in just 1 minute. It's not a too long exam, it's 30 minutes and 30 minutes. So you need to respond to the question, not from your brain. I used to tell this all of our colleagues. With training, if you train like if you are a driver, you drive the car without thinking about what's the movement, next movement of your legs or your arm. You just drive it. This is what we need to do with you to be prepared for this exam. We need to train you to have this driving response or reflex response from your spinal cord, not from your brain. If you started to think about it in your brain, you will lose time. It's very short. It's why most of the people get stressed, because it's very short and they need to express themselves. This make them express themselves in a wrong way. So training will help you to have training and the discussion of a lot of cases. Most of these cases will be a recall from the real exam, from the post exam. To do this with yourself, you need to train in the lecture. You need to train yourself with the faculty in the viva. You need to train at home with your colleague at hostel. It's 90% of passing this exam about training and be confident and have a rapid, accurate, appropriate response from spinal cord. This is our aim in this course. We need to prepare every one of you to have such kind of appropriate response in a time manner. Thanks so much for all of you joining us. Hopefully, inshallah, you will enjoy the course. Hopefully, we can add anything and help all of you to pass the exam, and welcome you as a colleague in Saudi Arabia as a practitioner and a consultant. By the way, for those people who don't know what about living in Saudi Arabia, it's a very nice. It's like living in one of the most previous European country. You will find everything very systematized, and all the people are very respectable people. You will find that all your rights immediately. You will not struggle by any means. My colleague in UK and in USA, they are dreaming to work in Saudi Arabia, to work in UAE. So it's not a bad move. Actually, it's a very appropriate move. This is from the lifestyle. From the career, you will find a lot of very prestigious hostel in Saudi Arabia. Actually, a hostel listed across the literature everywhere, being the first hostel doing heart-lung transplant, for example, doing the robotic, the King Faisal, the special King Faisal in Riyadh, doing the highest number of donor and recipient robotic liver transplant. So from the lifestyle wise, from the career wise, from the upgrade wise, from the knowledge wise, you will be so happy having part of your career life in this country. Thank you so much. We'll see you soon, inshallah, in our lecture. Dr. Faisal.
Thank you very much for this very nice words, very nice thorough explanation of the course, of the exam, very nice tricks. And honestly, I took from you this spinal cord reflex answer. Believe me, this is the key.
Most of the people don't remember anything about the spinal cord reflex answer. Actually, I learned it from Manny himself when I were enrolled in the course of empirical rate. So it's very important. It's very, very important, because most of the people remember it because it makes difference. Once he sat in the Zoom link with the examiner, and the examiner start to say anything about the case, he know about the case. So he start to respond unconsciously. يعني instantly he starts to respond, and he's very confident that he's going through the right way. So training is the sole pillar of doing a reflex, spinal cord reflex.
In fact, this spinal cord reflex will give you self-confidence and the stability during the exam. If you develop it the day of the exam, you will reduce the stress from 90% to 10%. And you'll be very confident because definitely, you know, 70 to 80% of the answers, just the manner how to approach that you will learn through the all course. And there is from our daily practice, and believe us, that this is what we are doing daily.
And
So
you will find the faculty challenge you during the viva to put you under stress. Don't be upset and don't be angry at us, because we wanted to put you in the most unpleasant situation which might happen during the exam. This is what we'll try to do with you in the viva session. But again, it means if you decided to enroll in this course, so you will pay some money. It's not a lot of money, but you will pay. So you need to get the utmost benefit of your money. Interact, ask, participate. Don't be muted. Don't close your camera. Be exactly as if in your exam. Across 8 sessions, you will be so confident if you started practicing with us from the first session. Can we hear, Dr. Faisal, if you allow, can we hear from any of our attending colleagues or planning to go through them?
Yes, we would like to hear from our friends and colleagues from the last session, Dr. Dr. Asadullah and Dr. Anis. So
then I need to listen from the candidate who will enroll in the exam. I need to know who they are, where they are working now.
Yes, great
one
idea.
One.
Yes.
And don't be shy.
السلام عليكم دكتور فيصل، دكتور إيهاب.
وعليكم السلام ورحمة الله.
مرحبا.
دكتور أنيس، ازيك؟
Nice to see you again.
It's a pleasure always, my friend.
How are you?
It's a great pleasure.
Yes.
دكتور أنيس.
Yes.
إن شاء الله تكونوا ملاح.
الحمد لله وأنتم؟
الحمد لله. We would like to hear from all the others.
Yes.
Dr. Anis, tell us about what you faced during the exam, during the course, what the course added to. Okay, go please.
Yes. In reality, in the beginning we have كنا تايهين يعني. We have no idea for questions or courses or the exam. What is the exam in reality. في الأول يعني ما كانش عندنا يعني فكرة على الامتحان هذا، على الأسئلة، على الممتحنين، كيفية طريقة الإجابة. يعني في البداية كنا يعني شوية تايهين، ولكن في when we start the courses، من أول كورس، أول لحظة يعني شفنا الديفرنس، شفنا أنه الحكاية يعني حاجة أخرى. وفي الحقيقة يعني all the faculties دكتور إيهاب، دكتور فيصل، دكتورة هيفا، يعني كل الدكاترة يعني ربي يحفظهم، يعني كانوا معنا في أي لحظة، يعني وين تحتاجهم كاين معناتها، وين نكونوا خلصنا الكورس، عندما تتصل به في أي مشكل أو أي حاجة فيه إجابة، فيه توجيه. والحقيقة يعني كاين ديفرنس كبيرة بين اللحظة اللي بدينا فيها الكورس وعندما خلصنا الكورس. يعني we gain more confident and يعني stress نقص بنسبة كبيرة. ما يعني stress يعني راح يكون فيه stress, but we master it in the day of the exam. تلاحظوا أنه هو نفس الشيء مع الكورسز الموك اكزام اللي كنا نديروهم في السيشن، يعني تقريبا نفس الشيء. تشوف روحك انك كنت في مرحله تحضيريه يعني تاع الصح، تحس روحك باللي راك في كيما كنا نديروا الكورسز. هو يعني هنا لازم الانسان يشارك في الكورسز. لازم واحد يهدر، لازم تكلم، معناتها ماكش راح تتعلم الانجليزي اكاديميك انجليش، but we master the professional English, medical English. يكون عندك طريقة في الإجابة، يكون عندك يعني فكرة على طريقة التعامل مع الكيسز في السعودية العربية، المملكة. يعني هكا تعطي لك كيفاش نفهمكم.
طيب دكتور انيس، ايه اللي لقيته في الكورس فرق معاك قوي في الامتحان؟
كيف
ايه اللي انت وات اكزاكتلي ايه اللي انت مارسته في الكورس معانا فرق معاك قوي في الامتحان؟ اديت الفايفا، اديت ذا نولج ليكتشر، اديت ذا تيبس اند تريكس اللي كان بيقولها الفاكولتي،
يعني
ولا
كله الكورسز الموك اكزام يعني كان في الفايفا، في الكورس او في الفايفا، يعني سبيشالي في الفايفا، يعني كان فيه انتراكشن بين الكوليجز اند اكزامينرز. يعني هذيك كانت فيها منفعة كبيرة،
طيب سؤال اخير معلش، honestly speaking كده بامانه، يعني ايه اللي لقيته في الامتحان كان نفسك تلاقيه في الكورس ما كانش موجود في الكورس؟
يعني في الامتحان
يعني ايه السيتويشن، ايه اللوجيستيك، ايه الابروتش اللي كنت حاسس ان انت لو
يعني في الحقيقة الامتحان كان نفس الفايفا اللي كنا نعملهم.
يعني ما لقيتش حاجه مفاجاه في الامتحان غير اللي كنا بنعمله؟
لا ما تفاجأتش يعني حقيقة.
اخر سؤال بقى، مين اكتر فاكولتي ضايقك في الفايفا وتشالنجينج وكده وبوش يو وحطك تحت ستريس؟
الدكتور
انا بندي
يعني احنا كوليجز اتفقنا انه الدكتور باسم.
لا ده باسم طبعا. احنا بندي جايزه لاكتر واحد بيتشالنج الكانديديت، هو الدكتور باسم دايما هو اللي بياخدها.
الدكتور باسم يس تشالنجرز.
لكن اي ثينك
والله كلام كبير هذا، اكثر واحد
اكثر واحد بيتشالنج واكثر واحد بيحط الناس على الرايت
يعني بين الكوليجز
يعني the best one.
No, the most who challenged us, but you are all faculties are
this is exactly how you will find your way in the exam to be challenged. والدكتور باسم احسن واحد بيحطك على الامتحان.
Yes he put us in stressful situations.
بنفكر نحط المحاضرات الدكتور باسم سبيشال لوحدها كده بسبيشال فيز. It's not about fees يا جماعه والله، I'm joking، بس يعني من قد ما هي بريشيوس قوي هو والدكتور هيفا محتاجين كنتوا تركزوا عليها، محتاجين كنتوا تبقوا very aligned معاهم و very interactive معاهم. دكتور باسم انت بتعمل ايه في الكانديديت يا دكتور باسم؟ دكتور باسم انت بتعمل ايه في
ما شاء الله.
I remember Anis, ما شاء الله. I tried to squeeze him but he could make it.
He passed the exam. Squeeze him as much as you can, but to pass the exam.
Yes الحمد لله
هو سكويز في الراحه خلينا نسكويز في الاكزام
يعني. اكيد.
يعطيك العافيه دكتور انيس. Thank you very much.
الله يسلمك.
We would like to hear from Dr. Asadullah. Dr. Muhammad Asadullah. I think he is with us.
He were with us, but maybe I left. Okay, it's time to leave to hear from our colleague that's planning to join the exam. Where are you working for the time being? What's your planning? Did you have the exam attempt before or not? We have 17 candidates with us. Anyone? Start not being shy and start to talk.
By the way, this is one of the tricks of preparation of the exam. You have to speak. Switch on camera and speak.
Hi, I'm Dr. Hajar. I wanted to speak.
Yes, please.
Dr.
Go ahead.
Assalamu alaikum, everyone.
Alaikum assalam wa rahmatullahi wa barakatuh.
I'm Dr. Hajar. I'm a general surgeon. I'm working in Riyadh in Durma Hospital. Really, I attempted the exam 2 times, but unfortunately, I failed.
So you are the most knowledgeable one. More knowledgeable people and most experienced people fail the exam in their first attempt because they wanted to express a lot of knowledge and a lot of experience. This is not the exam about.
Okay, really the first time many years ago. Yani now I'm working in Saudi Arabia for 12 years.
As I told you, it's not about you failed. It's not about failure. It's about you don't know about how to approach the logistic, how to systematize your mind. But failure in this exam doesn't mean that you were bad in knowledge or bad as a surgeon. I'm telling you something. Most of my colleagues and professors in Egyptian university, most 100 of them, they fail in the first attempt, and they fail in the second, and some of them fail in the second attempt. That doesn't mean by any means that they were deficient as a surgeon or have a gap in their knowledge. No, it's all about the logistic. And in this course, we try to put you in this logistic pillar. That's all. So don't be worried. Inshallah, you will pass it very easily with a lot of fine tuning about the tips and tricks.
Okay, inshallah.
Inshallah. Okay. Anyone else? Can I call the names on the meeting if you allowed me? Marwan, Leksami. We are all friends and brothers. Don't be shy, yani. You might be a colleague of mine tomorrow in my hostel. Okay. Marwan. Hawa Yahya.
السلام عليكم.
عليكم السلام ورحمة الله وبركاته.
This is me, Dr. Hawa.
Hawa.
Hawa Yahya. Yeah.
Okay. Yeah.
I'm working
Welcome,
in the
Dr. Hawa.
MAM.
Perfect.
Thank you so much. Thank you, sir. Working
So
the MAM private sector.
Perfect. This is your first attempt for the exam?
Yes, this is first attempt, first try, first everything.
It will be the first and last try, inshallah.
Inshallah, inshallah, inshallah.
Inshallah.
Actually, I heard about this course from colleagues who entered this course, and from the first attempt, they passed the exam. They advised me to go to this Dr. Muhammad Abu al-Bashar.
Muhammad, tamam.
Yes. He advised me to enter this course. He said that after the course, he actually entered the exam and passed immediately without any need for any revision, anything. And he strongly advised this course. And
I can tell you and all of other colleagues confidently, if you focus on this course only and you don't do anything, you will have a chance 85-90% to pass. But we usually advise you to go through the book to revise and read more. But this course by its own can give you 85-90% if you don't have time. But to do this or to have this percentage, you need to fully aligned and fully participating during the whole session of the course.
Okay. Actually, it's 5 years since I get my MD, and I think I'm so far from books and reading and exam. Always. So I need this course strongly, and I hope that I can get benefit from it. Inshallah.
It's not only you in this, all of the Arabic world in the medical field, they don't return back to the books except if they have an exam. That's why I used to tell my students all the time, inure yourself in any kind of exam. This is the only way to return back to your books. So wishing you, inshallah, success, easy success and easy pass from the first time as your colleague, inshallah.
Inshallah, with your help and support.
inshallah. دكتورة إيمان كافي. اوكي. دكتور كاسيموكا ستيمو. اوكي.
دكتورة ليندا كارا.
ليندا كارا.
Don't be shy.
دكتور خالد موسى. احنا I believe we got دكتور محمد أسعد الله تاني. أسعد الله. دكتور محمد, are you with us? Can you hear us?
I think still not. But okay. Dr. Ahmed Mahrez. We welcome Dr. Ahmed Mahrez.
Hello دكتور فيصل.
دكتور أحمد حياك الله. كيفك؟
بروف ازيك؟ ألف مبروك.
Nice to meet you again.
ألف مبروك.
ربنا يبارك في حضرتك.
كفارة يا ريس.
الحمد لله. أخباركم إيه؟ Nice to meet you again. يعني I really miss the lectures, the gathering with the colleagues and the faculty members. It was a really nice opportunity to know such decent doctors, decent professors. I really enjoyed the course. I really missed the informations, the training, the Viva sessions, the tips and tricks from all the members, especially Dr. Mahmoud. His secrets were very helpful in the exam actually.
بقول لك بيدي لك الزيتونه. محمود مع الزيتونه.
I really enjoyed and I really get benefits from all the faculty members, their recommendations. I really recommend the course for anyone who wants to go through the exam. Especially I had the first failure in the first one. Then fortunately I saw the Dr. Ihab on the Facebook for the 5th prep medical course. And
سامع دكتورة هاجر. دكتور أحمد أستاذنا وأستاذ الجراحة وأستاذ الأبر جي آي في كل حتة. بس he didn't pass the first time. It's not about the knowledge of دكتورة هاجر at all. It's not a parameter of how good you are as a surgeon or how good knowledge you have. It's all about the logistic.
This
is sure.
Very true. I already do some exams for students in the Faculty of Medicine in Egypt. It's about checklist, as Dr. Faisal said to us, Dr. Haifa, Dr. Ihab. You should think as the students think. It is all about the checklist and how to present yourself. It's not about the knowledge, as you will hear from all the faculty members. And I really believe that statements after the second trial. Fortunately, I had the same examiner in the second trial, the same questions, the same attitude.
but you were different. You were your different response.
Definite. I really once I realized that it is the same examiner. I was confused for the first question. But after some time or a few minutes, it's the same questions, but the answers for me, the confidence, the decision making, I believe that
Approach.
the approach, actually, it is not the knowledge.
You called your spinal cord to respond, not your brain.
Yes, exactly, Dr. Ehab. It is not about the knowledge. It is about how you answer, how you approach, how you decide. It is not about the knowledge. Actually, I really want to thank twice Dr. Haifa for his book first, for her book. It is a very helpful book in the exam. Also, one of the
She's
surgeons.
working on a second edition now. You can advise the second edition for everyone.
Very nice, very helpful book, very good book for the exam. And
did you go through the acknowledgement that was written in the book?
Actually, no.
Find Dr. Osip, go through it. You will find Dr. Basim Sharif, Dr. Turki had acknowledged in this book.
I already want to thank.
It's a huge project. It's a huge project. It's all done by Haifa. But to have some kind of senior revision or senior advisory is very important. So if you went through the acknowledgement, you will find Basim Sharif, you will find a lot of our colleagues there.
The very appreciating point for Dr. Haifa, for me, I am not a breast surgeon. I faced the last breast case several years ago. In my specialty, in my practice, most of my patients are GIT patients, hepatobiliary patients, liver transplantation patients. I am not facing in my clinic, in my hospital, any patient with breast cancer. This is not my field, actually. But the lecture from Dr. Haifa is very amazing. It can summarize the breast cases and how to approach these cases simply with guideline approach. That is, you can deal with any breast case. It was a very nice lecture from Dr. Haifa, actually. One of the most beneficial lectures in the course. The second team, actually, Dr. Mahmoud, Dr. Faisal, you are a very good team. Actually, your coordination, your presentations together are very. The most important thing in Dr. Faisal and Dr. Mahmoud, they never bore. You can the lecture can take 5-6 hours, and they are very helpful. They are very supporting. You have any questions, they answer. They can give you the secrets. They are very decent surgeons, decent colleagues. I really happy knowing these persons. دكتور
طب نسأل السؤال اللي سألناه بقى الدكتور أنيس. إيه اللي لقيته في الامتحان كان نفسك تشوفه في الكورس؟ What you faced in the exam, you wish to go through it in the course?
It is not about the topics, Dr. Ihab. It's again.
I'm talking about the whole situation. What exactly
actually
you felt? You're missing something in the exam was not in the course?
I think anyone study the course and revise the lectures, revise the Viva lectures, read the book, whatever the exam will be, he will pass. Actually, why? From the examiner I faced twice, he asked me the same questions. Some questions didn't hear during the course. Like a male patient, old, 63 years old, with atrial fibrillation, and suddenly started to complain from abdominal pain. This is not a case from the course.
Yes. We will not provide 100% of the case, but
Yes,
if you have the
this is
systematic
what I
approach
wanted.
to approach any case, you will be so confident. What you
Yes,
are saying, we're trying to get all recall cases from the previous exam, but definitely you will face a new cases. But if you have the systematic mind to approach any cases, it's not about getting the diagnosis or getting the
yes,
solution for the case, how to
this is
start and
most
how to go through it, and that's all.
Yes, this is the most important issue about the course. One of the questions about the male patient with inguinal swelling and diagnosed as inguinal hernia. You opened, tell me the approach, take me through the operation. And I started to answer about the open surgery. He asked the open surgical technique. And you didn't find any inguinal hernias. What will you do? As from the previous exam, you should. This is the ego, I think. You will face the condition alone. But one of the most important issue about the course is how to operate with your colleagues. Simply, I told him, then I will for a senior consultant.
Yes, this
And
is the best
discuss
answer.
with him the case, and we will find together the best management. He didn't talk any more about the case. These skills, these tips, tricks, whatever you secrets, as Dr. Mahmoud said, you will not learn it from any books. You will learn it from doctors like prep medical members who told you the these tricks, these answers. And I think this answer was the key point for my success in the second trial. So I really want to thank Dr. Faisal again, Dr. Ihab, Dr. Haifa, Dr. Turki, Dr. Basim. Your lecture was very, very helpful. I really enjoyed discussing
زنق كتير الدكتور باسم.
I cannot say that he just in the Viva lecture. We started. He gave me one of the cases I never faced, which is Clostridium difficile. I didn't face any patient with this.
But it's very common.
It's a serious problem.
It's very common in the exam.
Hello, Dr. Basim. Really helped. Really happy knowing you, actually.
الله يديك العافية إن شاء الله.
Thank you very much, Dr.
Thanks
Ahmed.
so much, Dr.
Thank you very
Ahmed.
much. I think Dr. Asadullah is with us now. If we can hear few words from him. Dr. Muhammad Asadullah.
Assalamu alaikum, sir.
السلام ورحمة الله وبركاته.
وعليكم السلام.
Dr. Muhammad.
So congratulations, first of all, congratulations for the
So,
success.
Muhammad,
of
your
the
face
exam.
really changed after your success.
Thank you very much.
It's not like getting a new bride. It's passing an exam.
Yes.
Tell us,
You see,
Dr. Muhammad, about your experience in the course and the exam.
Yes, as many of our new participants who are going to be enrolled in the course in the coming days, I will tell about my preparation and what I will suggest. First, of course, I will thank a whole prep medical team that they given an opportunity to solve our questions and queries. The first thing I learned from Dr. Mahmood that you should know why you are failed. If you have appeared before, you must ask yourself, what was the reason for failure? The second thing is for the newcomers, those who have not appeared, that they must know what is going to be asked in the exams. This is the second thing. Then the third thing is knowledge. How much knowledge is required to pass this exam? So all these questions will be solved those who will join this prep medico course. This is one thing. My advice to the newcomers will be that in this prep medico, Dr. Mani will give an access to the FRCS lectures. During my preparation, before the course actually started, I start listening to these lectures, and there were very good examiners from UK, like bariatric surgeon from UK, one breast surgeon from UK.
You became muted, Dr. Muhammad. You're muted. You're muted. Open your mic. Dr. Asadullah. You are muted. You are
Seem
muted.
to have.
Yes, sir. Now it's okay.
Yeah,
Yes,
it's okay.
Yeah.
So before the actual lectures started, they should read the text. They should listen to the FRCS lectures, and during these 3-month period, they should postpone all their activities, entertainment, and before the lecture, they should read the text from a very good textbook and be prepared and take this course seriously, because the exam is very serious. Our examiner in the exam are very serious. They did not give even a single mistake, that if we'll make a single mistake or blunder, they have no mercy, they will fail us. So we have to be very perfect in our answers. And what I learned from all of you teachers, that every case, breast, thyroid, trauma, endocrine, vascular, you must have background knowledge, you must have the approach. How will you approach the patient, your history, examination, your finding, your differential diagnosis, your provisional diagnosis, your labs, your radiology, and your resuscitation, like this CRISP protocol. I never have heard about this before, and I learned from this that resuscitation is important, and then management, then complication, and each complication you must know how to manage these complications. So this is my, you can say I was 20% and 30% with my knowledge and preparation. But with Prep Medico, my teachers, Dr. Bassam, Dr. Faisal, and all, they lifted us up to 80 to 90%. And as my other colleagues have told, after the finishing of the course, we were able to come to a level that we can meet the minimum requirement of this exam. So, Alhamdulillah, with the help of our teachers and by will of Allah, we are successful. Alhamdulillah.
Alhamdulillah. Thank you very much.
Congratulations, Dr. Muhammad. But for the other colleague who listened to the systematic approach of Dr. Muhammad, this is the idealist. But yes, don't be annoyed and don't be stressed by what he did. You don't have to go through all of this. Going through the FRCS lecture, which is free in our application as well. It's very focused lectures and it's very knowledgeable lectures. You'll get a lot of benefit from it in your career, actually. But if you couldn't go through it, it's not a big deal, because you don't have to do all of these FRCS lectures to be ready for SCFHS. But if you are able, it will be great. Going through the books and revising the knowledge, yes, it's very important. But Dr. Muhammad is very idealist person, and he go through every single steps, which is perfect. And if you wanted to be serious about this, you need to test yourself if you can go through all of these steps. Or it's not too difficult, and you can do it at your spare time. You can listen to the lecture at anywhere, in your job, in your house. So thank you so much, Dr. Muhammad, for your input. Wishing you all the best in your coming. What's your coming steps? What's your planning?
Yes, I am already. This is a lifeline for me. This exam, I was inducted as consultant general surgeon in Tuaf General Hospital, and I was waiting for my next year contract, and it all depend upon this result. So now I have the tasneef of as a consultant, So inshallah, I will get next year contract as a consultant as well. As a,
Okay.
I will continue as a
Inshallah,
consultant.
inshallah.
Okay, be tough in the negotiation about the finance with your new contract. You deserve it. Don't
Yes, thank you.
take the lowest, hit the highest.
Inshallah, thank you very much.
You deserve it.
Thank you very much.
Now we arrive, Dr. Ihab, if you permit, to the session of mock Viva simulation, and we would like to have some voluntary candidates. Any one of you? This is not exam. This is not an assessment. Just to give one or two scenarios, simulating the exam, just to make the picture more clear.
Okay, Dr. Faisal, we can go through the case by ourselves and we'll open the discussion. And again, I'm pushing everyone listening to us, just participate. It's not a big deal. Open your camera and talk.
If
okay, let's do it together.
So in this case, let's do at least one or two cases. Dr. Ahmed and Dr. Mohammed Basidullah. Dr. Ahmed, ready?
No, they already passed the exam. They don't have to go through the case again. They passed it. They don't do this again.
He will give him the real life exam. How will he answer? So you have a 44-year-old female presented to your clinic complaining of left neck mass for 3 months. How will you approach this patient?
First, I will introduce myself to the patient, including personal data, name, age, sex, occupation, and I will ask her about the chief complaint and the duration of the complaint. If there is any lump she felt in the thyroid, how she noticed it, any change since that time, any other lumps in the body, any associated symptoms of hyper or hypothyroidism as weight loss or weight gain, change in the appetite, any pain, any discharge. Then I will ask for pressure symptoms like hoarseness of voice, dysphagia, shortness of breathing, any constitutional symptoms as fever, weight loss, decreased appetite. Then I will ask her about the risk factors, including any history of neck radiation, any family history of breast cancer. Then I will ask for any symptoms of myths like bone pain, headache, abdominal pain, or joints. Then I will ask about the past medical history, past surgical history, the gynecological and obstetric history, any allergy, any systemic conditions like diabetes or hypertension, cardiovascular conditions. Then I will go for the physical examination after taking permission from the patient, assure privacy, assure presence of chaperone, then hand washing. Then I will go for general examination as ABCD.
Excellent. So the patient is 44-year-old female, presented to your clinic due to neck mass for 3 months. Her husband noticed the mass and it has been growing since that time. It's not associated with pain, discharge, or any symptoms of hyper or hypothyroidism. She has no hoarseness of voice. Her mother was diagnosed with thyroid cancer when she was 50 years old. She has no history of radiation exposure, and she is not known to have any chronic illness. No previous surgical history. On examinations, no signs of hyper or hypothyroidism. Neck. There is palpable nodule at the left thyroid lobe, 2 by 3 centimeter, round shape, smooth surface, firm, moving up and down with swallowing. No other palpable masses or lymph nodes. What will you do next?
I'll go for laboratory and radiological examinations. starting with the general examinations as CBC, liver function tests, renal function tests, coagulation profile, sodium and potassium. Then I will go for the specific lab investigations for the thyroid in the form of thyroid function tests. And then I will ask for neck ultrasound.
Excellent. So the thyroid function tests are normal, and ultrasound next showed heterogeneous left thyroid nodule measuring 3.2 centimeter in the length by 2.5 centimeter in the width. What will you do next?
Next, it will be the biopsy diagnosis in the form of fine needle aspiration from the left lobe lesion.
Okay. Will you do this FNA blindly or?
This should be under ultrasound guidance.
So let's say in your examination you have some cervical lymph nodes.
And if there is any cervical lymph nodes, I will ask for fine needle aspiration from the left thyroid nodule and from the lymph node under ultrasound guidance also.
Okay. The FNA conclude to follicular lesion of undetermined significance, but that's the 3. How will you manage this patient?
First, I will inform the patient that the fine needle aspiration diagnosis is not conclusive about the condition. So I will go for prepare the patient for tissue biopsy in the form of total thyroidectomy, as the patient has a high risk factor of malignancy as her mother having a thyroid cancer.
In the case, no family history of thyroid cancer, would you like to suggest the same plan?
I will not go for the total thyroidectomy. I will go for left lobectomy for tissue diagnosis. And this sure after vocal cord assessment, NBO, IV fluid, prophylactic antibiotic, and prophylactic medication for stress ulcers, and after consent from the patient about that maneuver.
Excellent. So intraoperatively, you started with the left side, and unfortunately, the left recurrent laryngeal nerve was difficult to identify. Later on, you recognize that you cut the nerve accidentally. What will you do?
I will remove only the left lobe and terminate the procedure for the result of the histopathology. This is a patient with the left recurrent laryngeal nerve injury. We will not go for the total thyroidectomy for the risk of the injury of the eye.
You did that, and the patient had smooth post-recovery apart from hoarseness of voice and discharge home. How will you follow this patient in the first outpatient clinic visit?
In the first outpatient clinic, I will check for the wound, remove the stitches, and revise the pathology result. And after clinical and physical examination through the history from the patient for any complaint, for any complications after the surgery.
What else?
I will inform the patient she has probably a cancer. We should go for a plan for the total thyroidectomy.
Would you decide alone?
No, in the MDT committee, after MDT committee, explaining the intraoperative complications.
Okay, and the final pathology results was single focus of follicular variant of papillary thyroid cancer, measuring 3.2 centimeter. What would be the best decision in the MDT?
I will discuss in the MDT session, and I think that the decision will be first to inform the patient about the the condition about the cancer, and she will need a completion thyroidectomy, as their disease needs a completion for total thyroidectomy. And we should inform her about the risk of the injury of the other side of the recurrent laryngeal nerve, and the possibility of tracheostomy after the operation.
So your informed consent will be precisely for two things. First thing is totalization due to papillary thyroid cancer. And
Yes.
what will be the second procedure? The patient should be informed, and you should have the informed consent.
She would have a consent for the complications from the thyroidectomy and the recurrent laryngeal nerve injury if it happened in the other side, in the form of tracheostomy and when charging the patient.
So you should explain to the patient that we have to totalize due to the family history and the pathology report, and there is high risk consent if we compare with other patients that she may have tracheostomy.
Yes.
At any time there is injury of the contralateral nerve. Okay. Alhamdulillah, the patient underwent an uneventful completion and discharge home. How will you follow this patient?
First, I will revise the final pathology after the total thyroidectomy, and discuss also in the MDT team. And I will do every 6 months thyroglobulin and thyroglobulin antibody, ultrasound neck examination every 6 months. I will give her thyroid replacement therapy with targeting TSH level from 0.1 to 0.5 milliunit per liter. Then also I will consider her for the endocrine treatment in the form of adjuvant radioactive ablation.
Excellent. One last question. In the follicular lesions, should we do close follow-up, or should we do tissue biopsy, and why?
In Bethesda 3, you mean, Dr. Faisal?
Yeah, Bethesda 3
Bethesda
undetermined
3,
signal.
we have two options in the form of tissue biopsy, in the form of lobectomy in patients with low risk factors. If there is high risk factors, as both the family history, previous radiation, other nodes, we should go for total thyroidectomy. The other thing will be molecular testing in some patients with Bethesda 3 to know if
Excellent. So we have two options: molecular testing, if it's not available, tissue biopsy in the form of thyroid lobectomy to search the capsular and vascular invasion, which cannot be diagnosed in the FNA.
Yes.
Thank you. Thank you very much, Dr. Ahmed. Thank you.
Thank you.
You have seen a typical case of the exam, as you know.
Allow me to comment on the previous case.
Yes, please. Please,
Dr.
Dr.
Ahmed, it was perfect. Clear pass was an excellent, and I need from all the colleagues revise your approach in taking down the history step by step, especially in the history. You finished the whole case in just 5 or 6 minutes, and this is what you need to do to pass. So don't waste a lot of time in history taking, but as Dr. Ahmed just perfectly go through the history, he mentioned everything, not in details. I'll ask about the hypo and the hyperthyroid. I'll ask about the risk factor. I'll ask about the previous history, the family history, the social history. Don't forget any title. Just mention it generally, and if the examiner, and most probably he will not do this, but if he asks about more details, you can tell it. But don't forget to highlight the broad lines of the history, and don't waste a lot of time on it. The second point is I believe you need to involve the MDT once you have a diagnosis. Once Dr. Faisal said it was Psi 3, so your response, your either response need to be, then we will discuss the case in head and neck MDT board. What do you think, what will be the decision? This you can give your input. Psi 3 can be done as a hemithyroidectomy and as a total thyroidectomy, provided that the loop has no other suspicious nodule, but you taking into consideration the positive family history of the patient. But first, you need to highlight that MDT should be involved before you took your patient in a subspecialty rather than a general surgery. Actually, thyroid, it can be done by general surgery, by ADT, by head and neck. But if you mention this, it will be in your best benefit, credit in the exam. The third thing, you have an option, either hemithyroidectomy or total thyroidectomy, but the preference of MDT will be total thyroidectomy because of high risk. The most important thing before any kind of operation that you are going to do, consent. You need to highlight that after you got an MDT decision, you need to have a sitting or have a meeting with the patient and inform him about the procedure and the possible complication he might have with the total thyroidectomy hypocalcemia, with hemithyroidectomy or total thyroidectomy partial or complete injury of the recurrent angina. So you need, once the examiner start to talk about any kind of procedure, you need to mention the consent, informed consent. In the operation, you faced an unpleasant situation. That time you need to call for help. Before you decided to close up the patient without moving to the procedure that was planned, you have to involve any other senior colleague, head of department, the head and neck consultant around, and you need to talk with the patient relative that something will change in the operation and not remove the whole thyroid because of what's happened. In the follow-up, all of the decisions should be shouldered to the MDT. To give replacement eltroxin or not, it's an MDT decision. After revision of the pathology, you started to talk about what you're going to do for the patient without knowing the pathology. Follicular variant of the papillary is an indolent disease. You need to know about the size. Is there any capsular invasion or not, lymphatic invasion or not? And even if the examiner didn't tell you this information, you need to ask about it, because it will be the sole parameter and the criteria to decide whether this patient will need to a diagnostic scan or not, whether she might need to an radiotherapy iodine as a treatment or not. In the beginning, once you get a thyroid profile or a thyroid, what you're calling Psi 3, you need to ask for thyroglobulin from the start. This is all what I have. But generally speaking, it was perfect. But this, I believe, it will not affect your pass rate in this case. But I think from my side, it will be much better. You are getting A with this approach, but I'm aiming to A+.
Yes. And
all
as
the
you
time,
know,
all the time, put in your mind MDT before taking any active decision for a subspecialty rather than general surgery. Always think about involving the patient in consent. And whenever you have changing in the plan, any change in the plan, you need to inform, you need to involve the patient. This is very important. Even put in your mind during any cases, the moment that you need to ask for help, ask for opinion. You have a mishap happening during the operation and you don't know exactly what to do. Or even if you know what to do, but you need to confirm and have a double confirmation from another consultant, it's very recommended in a real life, actually. Hatta in real life, you need to do this to secure yourself from the medical legal component, and you need to speak to the patient relative. But all in all, it's perfect. You need to go through the exam again to get a second A+.
thank you, Dr. Ihab. Thank you. And just for the information, the thyroid diseases, breast disease, and trauma, one of the most important chapters in the exam. Yani almost you should.
I need from the colleague observe exactly. Dr. Ahmed, he's a GI and hepatobiliary. Look how perfect he approaches thyroid test. And if you put a breast case or other any cases beyond subspecialty or beyond his daily practice, he will do it because he practiced all the branches before. This is what we are trying to do in this exam, in this course, trying to learn you and train you how to approach any kind of cases, even if you didn't see it in your life, in your entire life, even if it was a very rare case, if a very rare condition. It's all about how to systematically approach the case.
We are running out of time. We will try to get through a short case of trauma with Dr. Muhammad Asadullah. Dr. Muhammad, are you ready?
Yes, Assalamu
alaikum.
Are they going to be paid for this interaction? I believe they deserve it. This is their time. This is their precious time. They have to be paid.
We got our reward in the form of success.
Alhamdulillah. So, Dr. Muhammad, you are consultant on call and you have 23-year-old male patient brought to the emergency department by the EMS due to road traffic accident. How will you approach this patient?
I will wear my personal protective equipment and I will approach and examine and evaluate and assess the patient by ATLS protocol, and which have the component of primary survey for the life-threatening emergencies. I will start with the airway of the patient. I will ensure the airway is patent and ensure that the cervical collar is applied already. And then I will ask the patient his name so that I can be sure that patient is airway is patent. If he can answer, I will be satisfied that patient's airway is patent. Then I will move to the breathing, and in the breathing part, I will apply nasal cannula and oxygen to the patient. I will check the saturation of the patient, and in this part, I will look for the ventilation and oxygenation of the patient. And for most important thing, I will look on the chest. How is the patient, the symmetry of the chest? It is moving bilaterally, symmetrically. I will look, listen, and feel. So the most important thing to look for in this chest examination is the patient is not breathless, hypoxic, dyspneic, to rule out the life-threatening tension pneumothorax and cardiac tamponade.
If it is the case, you have asymmetria, no breathing from one side with jugular vein dilatation, and you are suspecting tension pneumothorax, what will you do?
So if my own examination, if the patient is the tension pneumothorax has three important things. His patient is tachypneic, hypotensive, distended neck veins, and breathless. And the affected side, if there is signs of bruise, chest movement is less, and auscultation, absent breath sound. So my diagnosis is tension pneumothorax. Immediately I will decompress the chest with the large bore cannula in the second intercostal space in the mid-clavicular line.
Before inserting your ICT, your vein, what you can do?
Before the ICT, I will, with the needle, I will decompress the tension pneumothorax, and the hissing sound will confirm my...
You put the needle decompression, and then you put the chest tube and the B, it's okay. Can you continue, please?
Yes. After this, if I make sure that the chest has only this tension pneumothorax, then I will proceed to the circulation part. In the circulation part, we will assess the heart rate of the patient. I will apply the monitor, cardiac monitor, and pulse oximeter and blood pressure monitoring, and I will look for this circulation part, any hemorrhage. There is one saying that 1 on the floor and 4 more, mean any external exsanguating, life-threatening hemorrhage. This should be controlled by pressure, packing, and or tourniquet. These are the options which I have to use. External hemorrhage. Regarding the 4 more, I will look for, if patient is hypotensive, not responding to our resuscitation with IV fluid or blood, we will look for bleeding in the chest, abdomen, pelvis, retroperitoneal. So I have to look for all these areas of hemorrhage. And
as by 11th edition, what is the difference between the 10th and 11th edition? What was added?
There is difference of X. In the older edition, X mean exsanguating hemorrhage is the first thing to look after and manage. And if there is
Okay,
external
stimulating
hemorrhage,
blood filling was excellent, excellent. So this patient, regarding the airway and sequela, the patient was lethargic but conscious and able to talk freely, and sequela was applied. Regarding the breathing, the oxygen via nasal cannula was provided, air entry was equal, and saturation is 94%. And as you did well, the already chest tube insert. Circulation, the blood pressure is 87/56 and pulse rate 132 beats per minute. 2 large cannulas were inserted and the blood was drawn for investigations and the registration was started with fluid and blood products. There are no signs of external bleeding, but the fast scan is positive for fluid. Abdomen is soft, slightly distended and tender, mainly over the left side with guarding. Despite registration, the patient is not responding. The GCS 14/15, no other abnormalities on the exposure, chest and pelvic X-ray, unremarkable, Foley catheter, brought clear urine. Ample history, patient is not allergic, and last meal was 4 hours prior to the accident. He was the driver, and another car hit his car from the left side. Vehicle, we didn't roll over, and no other victims died from the accident. As previously mentioned, what will you do?
So this patient has hypotension and not responsive to our resuscitation due to intra-abdominal bleed, as you mentioned that the fast is positive. So I will immediately prepare and I will take consent for laparotomy exploration of the abdomen to stop the ongoing hemorrhage.
So you shift your patient to OR. What will you do intraoperatively? What are the steps from ER to given the surgical steps?
So I will inform the anesthesia team. I will inform the blood bank for if needed massive transfusion protocol and resuscitation. I will start with the 111, the blood products, FFP and platelets, and I will prepare the bed in ICU, take consent for surgery, and shift the patient to
if the patient is unconscious, how could you take the consent?
We will take from the medical director and from the if immediate relatives are available, it's okay. Otherwise, 2 consultants available at that time, including the medical director. He will sign and will.
Now you are, everything is ready. The patient is under anesthesia. You direct and you prep the patient. Tell me what's next.
Before giving the incision, the timeout is very important. I will ensure that all the equipment are available regarding the laparotomy, if needed, vascular set and blood products are available, and correct procedure, correct patient. And I will, with the permission of the anesthetist, that if the patient is hemodynamically unstable and blood is already ready, with his consent, we will start the incision, drape from nipple to knees, and give a long midline incision from Z5 to the symphysis pubis. And I will pack the 4 quadrants on.
Before doing incision, what should you do?
We will drape the patient and prepare the patient.
And anything with anesthesia team?
I will tell the anesthesia team the patient has tamponade effect in the abdomen. On opening the abdomen, this tamponade effect will go and patient can go into hypotension. So blood should be available and rapid transfuser.
You did the incision, you put the 4 packing in 4 quadrants and you start to remove from the least to the more bleeding side. And the intraoperative exploration was the ruptured spleen. What will you do?
Definitely we will proceed for the splenectomy in this patient.
With
splenectomy, and later on after the splenectomy, we will explore the rest of all the viscera, starting from the abdominal esophagus, stomach, duodenum, small bowel, mesentery, colon, livers, and rectal area, and retroperitoneum, and ensure that there is no missed injury.
One last question. Your postoperative was very smooth for your patient, and you are planning to discharge at postoperative day 7. What precaution in the follow-up?
Before discharging this patient, we have already done splenectomy in this patient. So we will advise him that we'll start with all the complication. Wound is okay. There is no infection. There is no respiratory complication, atelectasis or pneumonia. But most important, post-splenectomy, our advice will be to give vaccination for this patient.
Thank you, Dr. Muhammad. Thank you very much.
Can I add something? Can I add some twist for this case? You did all of this, Dr. Muhammad. Post-operatively, you was shocked that the patient get paralyzed, paraplegic. Why?
Because if we have not completed our primary survey regarding the deformity and the exposure of the patient regarding the spine, we should complete our primary survey.
You didn't do it. You didn't protect your cervical spine in your primary survey. The patient have a cervical spine injury and you moved him to the OR without a neck cooler, and unfortunately the patient gets paralyzed.
But I in the primary survey, I started with the cervical collar. I told that
he put the
yes.
cervical collar. He started with collar.
I didn't hear it.
Yes, yes.
No, cervical spine. Okay.
Yes, yes. It is very important. Yes.
So you started with cervical. Once I didn't hear it, unfortunately. I'm sorry, but while you are going to do a primary survey, and this is for all of your colleagues, it's trauma cases. You have to get at least 2 trauma cases in your exam, either long or short cases. And all of the people who are planning to attend, they need to memorize by heart ATLS. ABC, A, B, C, D, E. You need to memorize it by heart because you will face it. And it's a very easy scenario to pass and very easy to fail. Because if you forgot any important thing of it, you will fail. Actually, as I received from Dr. I didn't hear about cervical spine, so it will be a failure. Okay. So APC should be memorized by heart and should be spoken loudly and confidently and taking all of the items together. You cannot start any kind of station step by step. You have a team and all of the team working with you together, and you need to involve your adjunct. You didn't mention it. You have to get adjunct. You are in airway. You need to mention the adjunct airway. You are breathing with the adjunct. You're having an X-ray in abdomen. You need to ask for fast before moving. Dr. Faisal told you about the fast, but you didn't ask for it. So memorizing the ABCD is very important. You didn't rule the patient. You need to look for the back of the patient. And in a short cases, most probably the examiner will stop you at some point. But whenever you are proceeding into one-to-one, you need to mention everything in detail. It's not like taking a history in the clinic. Again, before taking the patient, you have you need to start with the oxygenation of the patient. You can tell it like this. I'll go to see the patient myself, making sure that the patient has been resuscitated and managed as per ATLS protocol APC, making sure that the patient has been well oxygenated and the oxygen and on mask oxygen. You need to tell this. I need to know the patient at least 15 liters per minute. It's a standard. And 2 wide pore cannula have been inserted. And the neck cooler was in position, rigid neck cooler was in position before starting anything. Then you will go through A, B, C, D. With every A, B, C, D, you need to mention adjunct. You need to mention fast. I need to have an available fast around the abdomen that's distended. There might be hemorrhage. And once you suspected hemorrhage, what you need to do immediately, as per crash trial. You told us that you listened to the FRCS lectures. What's crash trial? What's crash trial? You are muted.
Yes. Crash trial. Now I don't remember, but you can explain us now.
You need to start once you suspected in a trauma in a bleeding. You need to start tranexamic acid immediately, within 10 hours. Once you define an hemorrhage, and you will continue an IV tranexamic acid for the coming 8 hours, decreasing the mortality up to 20%. 20%. This is why it's a standard in ATLS protocol. Tranexamic acid, you will find it in everywhere. Go to the ATLS paper. Tranexamic acid is very important. And again, with a bleeding, you need to announce the massive blood transfusion protocol. From the start, you did assure that you have 2 wide pore cannula and the basic collapse was taken and sent for labs for coagulation profile, LFT, and the blood grouping and matching. And once you have a massive bleeding, announce the red code, the massive blood transfusion code, because you need all of the hospital to be aligned. This is a real life, by the way. And you need to make sure that the patient started to get a ringer lactate. So mask oxygen, ringer lactate, neck cooler. Then you will proceed through your ABCD. Okay, and once suspected anything in AP, if the examiner stopped you in an airway and start discussion with the patient, don't move to the next. Don't move to the next step until making sure with the adjunct of the primary survey. Primary survey is not only an examination; it's aided by adjuncts, and you need to use it. If you faced a situation that the examiner stopped you at some point, you need to start to discuss in detail what's the further management. Okay. If you decided to take the patient to the OR again, you need to fill down the paperwork, the consent, the time out, the sign in, the sign out. All of this must be mentioned. You cannot forget it, especially the consent. You are going to secure the patient. Some words in the exam may trigger the examiner. You can say it unconsciously, but with the confidence, you will drop all of these. You said, مثلا, for example, you will open the patient from the deep sternum to the knees. As an examiner, I was prompted by this expression. I'm not going to. If the examiner stops, he might stop you at this, and this might cause you some irritation. So for the people who's going to enroll in the exam, actually, as an examiner in the exam, you will have a clear pass on this. But the only failure, if you forget a C-spine, I didn't listen, I didn't hear it, I mentioned. And this might happen in the exam as well. You might say something very crucial and might be misunderstood by the examiner or didn't received by the examiner. If he told you didn't mention C-spine, you cannot argue with him loudly. You cannot fight with him. You will say politely, excuse me, sir, but I said it in the beginning that I need to put confirm that the C-spine or cervical spine is secure. Politely, don't tell him that you forgot what I said or you are not focusing with us. Most of the examiner actually do the exam during the daytime. Some of them might have a procedure inside and doing the exam.
Yes.
So you need to just remind him politely, and this happens a lot. Don't be in a fight with him. All in all, this is a trauma case. Trauma case is very important. ABC should be memorized by heart. ABC of the trauma and ABC of the CREST protocol should be memorized by heart. You will face at least 4 cases, either an emergency abdominal cases, you need a CREST protocol involved, or a trauma cases in the emergency department.
Thank you very much, Dr. Ihab. Thank you very much. This is the typical.
Thank you so much, Dr. Muhammad. I know it's not the exam, but there is a very important thing. I believe you are not in the exam mode. That's why I was objecting that you and Dr. Ahmed taking this scenario, because you are not in exam mode. So you'll not be focusing on what's need to be said. But even if you are not in exam mode, but you are perfect, mashallah.
I recently passed, so still I am in the process of my mind is still in the exam process.
But you are in a calm mood. Post-exam mode, it's a relieving mode. You don't have to be in another exam immediately after the crucial exam. I believe if you are in the exam mode, like one of our candidates, if anyone volunteers to take this case with us, I believe tranexamic acid is very important. Tranexamic acid, no way, don't mention tranexamic acid. The adjunct of the primary survey is very important. The consent, the massive blood protocol is very important. Lactated ringer, mask oxygen, 15 liters per minute. It's very important. Perfect.
Thank you very much.
Thank you very much, Dr. Ihab. Thank you very much, Dr. Muhammad. This is the actual scene, what happened in our vivas across all the course. We gave the case, and just after, we gave the feedback. And you have seen Dr. Ihab, he very, very nicely presented all the positive and negative points.
I'm the very benign one in the faculty. يعني for all colleagues who are listening, I'm very benign. You will listen to a more harsh criticism from our colleague. It's for your benefit. All of us need all of you to pass. So don't be upset if you face such a harsh or a difficult criticism about your approach. It will be
In fact,
good
it's
this time.
a real life exam. This is a real life exam situation.
I think it is an advantage, Dr. Ihab. Not all the examiners will be benign in the real exam.
Oh, this is what I'm telling to our colleague or planning.
Absolutely.
The examiner will not so kind like what I'm doing. They will be harsh. They might stop you with an aggressive word. It's like, you will open the patient from ZT stem to the knee. Tell me how you're going to approach the knee. When you did the knee, and the exam will be about how to approach your incision to the knee. I faced this with another examiner. I attending as an examiner in some parties. I'm facing this with there's a lot of other tough examiners, and they are waiting for such kind of words to haunt you.
Yes.
Yeah.
And you cannot blame them. He said it. He said he will open to the knee.
In MD examinations in Egypt, as you know, Dr. Ihab, not all the questions, or actually all of the questions, comes from the words from the
your words. Exactly. And this is, but in a systematic exam like SCFHS, they follow a standard scheme. They follow a standard checklist. But if you said something to prompt you, they will do it. Definitely, they will do it.
Absolutely.
And what happened in this scenario? You might face an exam, didn't listen what you said. Don't be upset. Just try to. This is happening also. Trying to remember or remind them politely and smoothly.
I hope the picture now is more clear through all what we discussed during this webinar. We warmly welcome Dr. Mahmoud Talat, our friend and brother, to give us his tips and tricks to preparation of the exam.
The secrets, not tips and the tricks from Dr. Mahmoud.
Secrets, خلاص خلوها secrets. Dr. Anis, تفضل.
Yes, just I have to go. I just want to say one last word to future candidates. Today you had the opportunity to see just a sample of the session. If you want to pass your exam, don't just think about registering, but just do it. That's my advice. Because I think that's the best way to ensure success in the exam, honestly. Yes, and Dr. Faisal and Dr. Ihab, all the faculties I1s, really pleasure to see you again today.
Inshallah.
We are looking forward to see you physically, Dr. Anis.
Inshallah.
As one of our colleagues in one of these hospitals.
بارك الله فيكم ان شاء
الله.
انت فين يا انيس دلوقتي؟ انت فين يا انيس دلوقتي؟
What؟
انت في انهي مستشفى دلوقتي؟ فين شغال؟
I'm waiting for job for the moment.
Okay.
Yes.
Good luck ان شاء الله. Good luck.
ان شاء الله. بالتوفيق ان شاء الله.
Goodbye.
Dr. Mahmoud, floor is yours. Dr. Mahmoud, do you listen?
Assalamu alaikum, everybody.
Alaikum salam. Welcome, Dr. Mahmoud.
Sorry for not attending from the start.
لا تدفع غرامة يا ريس. تدفع غرامة. ايه اللي جايبك متأخر؟ احنا مستنيين الزتونة من ساعتها. جاي متأخر تدفع غرامة وكل الناس مستنية السكرت الزتونة بتاع الامتحان. محمود طلع.
يا دكتور إيهاب، يعني you are our professor and our senior colleague. طبعا انا طبعا بعتذر. I'm sorry because I'm just I was on call today. I was trying to solve some cases.
عارف انا بهزر مش هدفعك حاجه. انا كنا متشوقين نسمع الناس كلها متشوقه تسمع الدكتور.
ما يعني
انت بتقبض عشان تدفع، انت بتقبضش عشان تدفع.
بالضبط.
لا You have
7
7
minutes
minutes.
only. لا بتضحكوا
We
عليا
are
كده.
running out of
لا
time.
لا فيصل سيبه. لا take your time يا محمود. You are the most important tips and tricks that will be said today.
طبعا سوري
Take
يعني
your
طبعا
time.
يعني of course السلام عليكم دكتور إيهاب my professor and senior colleague Faisal my friend brother and my twin in hospital and in this prep medico. Our new colleagues دكتور محمد أسدullah, دكتور أحمد محرز, congratulations again for passing your exam, and we are very happy for you passing this exam and become new colleagues in consultant club in Saudi Arabia, inshallah. Soon we will see you all here. All new candidates or all new attendants or colleague doctors, welcome today. طبعا today is Friday, a good day in Muslims culture, and by this occasion there is an acceptance hour in Friday. I hope I will pray for all of you to achieve your aim, especially from attending this course. And talking about the aim, if I ask it, what is your aim from attending this course? The question is for the 17 or I think more colleagues attending this lecture. I attended or I listened to some of you as interrupted parts from this lecture, and I heard in fact the right answer. Most of you said the aim is to pass this exam, and if it is your answer, it is all the answer of all of you all. This is the right answer, and this is the right place to achieve this aim. You have secondary aims, of course, and we will achieve some secondaries like some knowledge, of course, some tricks to deal with cases, especially in Saudi Arabia. But the main aim of this course is to achieve to pass. Me myself, in fact, I can tell that I am the least one of our faculty. We have a great faculty. دكتور باسم, دكتور إيهاب, دكتور هيفا, دكتور تركي, فيصل of course, دكتور عادل محجوب, الله يرحمه. We pray for him. Me, I am the least one in knowledge, and I am the youngest, not in age, but I am the youngest in the knowledge. But I keep myself in a very narrow, safe zone, which can I say it is the zone of secrets. And what do I mean by this? I mean that, as I said, to pass this exam, it is not about what you know. It is about how you present your knowledge. I think I heard some of colleagues that most of the candidates who went through this exam before already has the knowledge, but they couldn't pass because they don't know the way, or don't know they don't have, I like this word very much, the mind set up to pass this exam. Even they have the knowledge. So these secrets will change your mind setup. I change your mind setup with these secrets of passing this exam. In fact, in this course, all of us, of course, it is not, I like these secrets, but it is not only with me, of course, it is with all the other faculty, of course. We go through we go through something we call rule of threes. We have three threes or 5 threes, we go through it. The first 3 is we identify the exam for you. When we identify the exam for you, we say there are 3 persons you will meet in this exam. Of course, most of you, or all of you knows that this exam is online exam. It is an oral exam online, and in the day of exam, you will meet 3 persons. The first one is the administrative one. She is or he is not a doctor. He is just an employee that he makes sure that you are the wrong person. You have your ID. The setup around you is fit for the criteria of the exam. Through something, the timing of the exam, by the way, is very important. The timing of the exam will be in the Saudi Arabia or KSA timing, not the time at your country. So you should consider the time difference between you. This is very important tips to just start or get the exam not stressed. Also, you will meet other 2 persons to continue the rule of 3 persons, 2 examiners, each examiner, by the way, he tests something. They are not alike. They are different. They are different in personality and different in questions and different in attitude. One of them, he wants to test just your knowledge by short, rapid questions. He will be calm, he will be benign mostly, but he will test your knowledge. The second one, he will be a little bit stressful on you, and he will test your approach as a consultant. They will, those 2 examiners search for the second rule of 3. What is the second rule of 3? Are the 3 skills. They are searching for it or testing it in you. The first skill, of course, is the knowledge. We cannot be consultant surgery without knowledge. So, of course, there will be the knowledge. But the knowledge is basic for GS. Here in Saudi Arabia, if you know, in Saudi Arabia, there is general surgery and there are many subspecialties. So this exam is for the general surgery only, license, not the subspecialty. The subspecialties like hepatobiliary, colorectal, endocrine, upper GI, these subspecialties will not be asked in the exam. So the knowledge will be just basic for the GS. Also, they want to hear keywords. This is a very important secret. Please don't forget this word, keywords. In each lecture or each subject of topic, we say some keywords. These keywords, if you say it in your answer, it will be very great, and the examiner will admire you and will like you, and even he will help you if you did something mistakes in other questions. So the knowledge should be basic and specifically will give you the keywords they need. The second skill he will test is your approach. What do I mean by approach? What approach? I mean what the way of dealing with the patient as a consultant. I know the resident can deal, the specialist can deal, but the consultant should deal with a special way. What is the special way you should deal with the patient as a consultant? First thing is the safety. You should be safe consultant, and he will test this through your answers and through your approach and through your arrangement of answer. He may ask you a question and you have 5 points to answer. The 5 are right, but you should start by one of them. This one, if you start by it, so you are a safe surgeon. If you did not start, even if it is right answer, you are not a safe surgeon. You didn't pass this question, especially, and these are very important kinds of questions that they test the safety of you. The third, also, as a consultant, you should avoid fatal conditions that could cause patient to die or to be missed from you. The third skill is the stability. Your stability as a consultant also in a stressful situation. All of us are surgeons. We faced very many stressful situations in surgery, like bleeding, for example, and we should deal with it. We know how to deal with bleeding. We put compression, we call for help, we tell anesthesia, we bring blood, we do cross-matching and so. But in the stressful situation itself, do you will remember to do that? So he will test this point, especially in your personality or in your attitude as a consultant. How? He will test it. He will not put you in an operation, but he will ask you a question. Could be difficult or could be strange question or could be simple question. And after that, he will stress or he will push on you by his face expressions. He will, when you answer, he will say, really, are you sure? Is it your answer? You will do that, really? It is right. It is the answer is right. But he will press on you by his response. He will make you not confident. He will make you stressed. And at this time, he will see your response as a consultant. If you collapse and you could not answer or you get aggressive, for example, that means that you will not pass this skill. But if you kept calm and told him, yes, I'm sure, this is my answer, and keep a very neutral smile with you, yes, sir, this is my answer, I will do such and such. And if you are not sure, even you will tell him, I will ask for help from other senior colleagues, or I will ask for help from subspecialty consultant. This is the right answer, or this is the right attitude for answering this or for testing this skill, which is stability. So these are the 3 skills they will test. For these 3 skills, we will give you 3 tools to have the skills to change your mind setup, to change your mind setup to be to have these skills to pass these skills, or to show him that you have the skills. What are these 3 tools? The first tool, of course, it is the informations. It is the knowledge we give through lectures and through books and through our notes we will send to the group or in the library. And the information has criteria. It should be only the needed information, because you don't have time. You don't have fitness. You don't have brain fitness. All of us are elder enough. We finished our postgraduate degrees, and we studied many years, and now we are working and have social life and like this. So we don't have time, and we don't have fitness, mind fitness. So the information will be only the needed information, no extra information, with the minimum effort. The second tool is the training. I like to name it as simulation. I put you in each Viva in multiple times like the exam. I will put you many times like the exam. You will attend the exam at least 10 or 15 times before the actual exam. So when you go to the exam, you will feel like this is just a journey. This is one of the Vivas I attended. This is the training or simulation. The last tool we give you is the evaluation and the feedback. We don't just we put you in a situation or in the something like the exam. We also give the feedback in the Viva lectures, and finally in the mock lecture, in the mock or the simulation. The exact simulation of the exam will be the mock, and you will be in a true exam with 2 examiners, and you will be asked, then answer. Then we will give you for 15 minutes after that the evaluation and feedback, what you did well and what you should improve in your answer. So these are the 3 tools we will give you: information, training, and evaluation. We consider 3 things also as a rule of 3 in your circumstances or life. The first is timing. As we said before, you don't have time. All of you work maybe full-time or in one job or more than job, so you don't have time. So you need only the as we say, the zatuna olive, the important thing. The second thing we consider is your lifestyle. You are not only a doctor. You are a doctor. You are a father. You are a husband. You are a friend. You are you have many things. You have habits. You have hobbies. Sorry, you have hobbies. You have you like to read, you like to play sport. You are not only the doctor. So we will give you the keywords and the secrets, as we say, for passing the exam or for making yourself presentable at the time of this exam. The last thing to be considered is the deconditioning. As we said, you finished your studies and your exams a long time ago, most of you. So you are not fit. Your mind is not has no fitness for studying or reading. So we take you from the zero and step by step through the lectures. So the first lectures will be calm, and the first Vivas will be easy and calm, but after that we will take you to the higher level that exactly simulate the exam, ending by the 2 mocks that which are the exam like. Aim of this training, we have only 3 aims of this training as a rule of aim. The first thing is improvement of your language. The improvement of your language will improve fluency in the exam. This exam is full English exam. You cannot, or better, of course, not to say any word in Arabic or any other language. And the fluency, the time management. This is a very important issue and very important secret in the exam. This exam is a time-dependent exam. If I ask you a question and I give you 3 hours, you can answer this question easily. But if I ask you a question and I give you 3 minutes, you should say the most important points only. If you did not say the most important points, you will not pass this exam. If you said the important points in 30 minutes, you would also not pass this exam, because the examiner, it is not his time, it is your time. The examiner will keep you talking. He will not stop you, even if you are talking right, and even if you are wasting time. He will tell you, did you finish? Yes, you finished. You answered how many questions? You answered one question in 30 minutes. Okay, I finished also, but you answered one question from 6 questions, so you did not pass the exam. The second important aim of training is the empathy and admiration of the exam, and this is one of the most deep secrets that's dig in the psychiatry of the examiner. I always say, finally, it is an oral exam. Finally, he is a human being. Yes, they have checklist, they have system, very strong system here in Saudi Arabia, by the way, in everything, not only in the exam, and not only in health, in everything, even in the street, even in the traffic, everything. You have strong system here. So, but finally, he's a human. If he admired you, and if he liked you, and if he was empathy with you, he will help you finally. So if your answer is arranged, if your answer is good, looking good, you use keywords, you avoid fatal mistakes, you have good approach, he will help you. He will help you if you did some mistakes, and he will admire you, and he will be he will want to make you pass. So we need to earn their empathy and admiration by repeated training. Last thing is, I will give you the self-confidence. As I said, if you pass, if you simulate the exam 15 or more than 15 times through the course, you will go to the exam very self-confident. You know what they will ask, and you know what will you answer, and you are confident about yourself to answer the questions without stress, or without forget something, or collapse it, as we said, or getting aggressive. So this is a very short introduction. Of course, we go through this introduction through all the lectures, by the way, and use it through all the lectures to put the right secret in the right position. And finally, we change your mindset up to pass this exam. Good luck for you, and thank you for attending this lecture.
Thank you very much, Dr. Mahmoud. Thank you very, very much for these secrets, tips, and tricks. And this is, as we said, well, Zaytuna, Asal al-Asal. If you follow all these recommendations and these secrets, definitely you will success the exam. And I will just add the one question by 1 minute. In the exam, you will have between 2 to 6 cases in every session. Every case will have a minimum of 5 questions. So you will have 30 questions within 30 minutes. So the end point of the course is to be able to answer one question in 1 minute by giving the keyword, time management, safety, self-confidence, stability, all the secrets that was mentioned by Dr. Mahmoud. And also the other advantage going through the lecture and vivas, and also having this option of recorded video within 3 months or 12 months is extremely important, because whenever you want to revise the material, the lecture or the viva, you can just listen. Whenever you have time, just listen and revise. And definitely, if you don't have time to read, by just listening, you will revise. And this is very, very, very important. The next slide, as we arrive to the end, there was a lot of questions regarding how to apply. I will try to explain very briefly, if you permit. I will share my screen again. I will show you our website, official website. Can you see my screen now? Can you see my screen now?
Yes, Faisal, your screen is
Excellent.
shown here.
Okay. This is our official website page. As you see, this is the Prep Medico official website. So you can see here all the subspecialties, but the SCFHS is made easy. You will just find it in the top. Click on SCFHS and you will find our page. Some advices in the introduction to the course, the rate of success, and answering to very important questions about eligibility, exam details, exam preparation, and what happened after getting the exam. The links to our channel YouTube, if you are interested to see our previous webinars. Then our faculty, as we mentioned before, all the team are here. Then a model of the schedule of course. This is just a model, but what I shared previously is the official one for the 6th course. So by going through lecture and vivas within 7 weeks and the mock viva exam simulation by the end of the course, based on the offer. If you want to enroll, you will find here 6 course enrollment. So if you are interested, you will click here. If you are interested for specific chapters, for example, let's say you are interested to enroll just in the hepatobiliary surgery, you can just click on the enroll in the specific chapter and you will be able to attend to the lecture and the viva for the specific chapter that you want to revise or view or take more information regarding that. If you want to subscribe to the course, just click on enroll the course and you will have all the options. You will have the options of 12 months library access, 3 months library access. You can book for just the mock exam. And this is very interesting for those who have an exam for soon. For example, you are planning to pass the exam within 2 weeks and you have a date. It would be interesting to have this mock to assess yourself, your knowledge, safety, approaches by one of our senior faculty. Also, if you want to just have an access to the library to get information, you will have access to this part here and mock viva, as we said before. Let's say you want to take the offer of 3 months. You will click on enroll now, choose a plan. Would you like to be observer or participant? Definitely participant is better because observer you will just watch without being able to interact. But participant, you have the full ability to participate, talk, discuss whether in the lecture or in the viva. And it's very important. Click on the enroll now, and it will take you to another window to put your data, email, view card is put view card, and if there is coupon, you can put the coupon here, proceed to checkout, and you will have to fulfill here these gaps: the name, country, address, town, email address, then date of the Visa card or Mastercard or whatever. Place the order, and then after payment, you will receive a confirmation email, subscription to the LMS, our library, and automatically will be added to the WhatsApp group of the course. This is briefly how to enroll, because there was a lot of questions and it was an advice from Dr. Basim. He observed that there is a lot of people that are asking about how we can enroll. So this is briefly how you can apply. I think we arrived to the end of our webinar. Feel free to ask any question. If you have any concern, any question, feel free to ask. We are here to help you and to answer. the textbook, we recommend the study surgery book from Dr. Haifa.
Who is asking, sorry, about the textbook? Who is from where the question? I want to tell him something. Dr. Omar. Dr. Omar. Dr. Omar, look, in my introduction, I said something very important. We should consider your time. We should consider your fitness. It is not applicable, and it is very difficult to study from a textbook. You cannot study 2,000 pages before this exam for two causes. In fact, the first thing is you don't have time. This is the first thing, especially if you want to do your interview soon. The second thing, if you studied 2,000 pages, you will forget the important 100 page that you will be asked at this exam. Our course is very targeted to what you will face in the exam, either by the questions itself or by the attitude or the mindset for the examiner. And I think our previous colleagues, our previous candidates, now colleagues, they experience this very well. Some of them are professors in Faculty of Medicine in their specialty, but they needed only very small amount of knowledge to know and a very big amount of approach to pass this exam. Studying from textbook, I say it will waste your time.
دكتور محمود، السلام عليكم.
وعليكم السلام ورحمة الله وبركاته. أهلا دكتور أحمد.
أخبار حياتك إيه؟ كل سنة وأنت
الحمد لله حبيبي، تمام. طب صح السلامة دكتور أحمد.
Some of your colleagues asked, or your candidates asked again about the recent advances in surgery. It is not from my experience, as you will hear from your instructors in the course. It is not about the knowledge. It is not about the knowledge, as you will hear from all the members. It is about the attitude, the approach, the tips and tricks. You will hear from Dr. Mahmoud, Dr. Faisal, Dr. Bassem, Dr. Turki, Dr. Rehab, Dr. Haifa. The knowledge, you will hear it from the lectures. I really enjoyed some knowledge from the lectures, but it is not about the knowledge. It is about the way you answer, the way you think, the decision making. I think this is the most important issue you will learn from the course. Actually, the knowledge is very important. You cannot answer with very wrong questions or something weird. Actually, this is what you should consider in knowledge, but it is not about the knowledge. It is the mindset, as Dr. Mahmoud said. It is about the way you answer, the way of approaching a patient, and the self-confidence. This is the main issues you should consider, how you should try to obtain from this lecture. This is my advice and recommendations for the new candidates from my experience and from my 2 trials in the exams.
طيب يعني in order
Thank you, Dr. Ahmed. Thank you very much.
Let's summarize what was mentioned about what you need to go through from the textbook. I totally agree with Dr. Mahmoud. You cannot waste a lot of time in a huge textbook. Actually, the lecture that we are preparing as a review lecture, we try to get the most appropriate reference for the exam. And if you have the time, and you can go through one of the books, what we recommend, as Dr. Faisal said, it's Dr. Haifa books. This book was created for the exam.
Yes.
It's a very nice written book. It's very systematized. It hits the tips and tricks and the exam and topics and the knowledge need to be approaching the exam. But again, if you don't have a time in the course, inshallah, yani, we can assure you 85-90% if you were totally focusing with us in the lecture and the viva. And I know a lot of other previous colleagues did nothing apart from the course, but were totally aligned with us, and they pass it very smoothly. But again, if you have a time, yes, you can go through it. If you choose one of the textbook, go through Dr. Haifa book, the surgery or study surgery book. That's all. But don't be constrained about you didn't revise a lot of textbook for that exam. You don't have a time. Don't stress yourself by this more. I believe Dr. Mahmoud trying to explain this. It's all about having the specific knowledge needed for this exam.
So
I hope the message.
They have time.
The book, where to find the book? The book is in I believe it's in Amazon. You can find it actually in it's an online book. You can buy it from the online. As I said,
so I think available.
Most of our
available
lecture,
for our library for lecturing, not for download.
I don't know. I don't know if Haifa permitted to be put in our library or not. Anyway, if you find it in our library, it would be good. If not, it's not expensive book. You can buy it, and it's very nice book. You can keep it as well. As I said, most of the lecture review, you have two parts of components in this course. It's a lecture review. It will be a trial from our faculty to revise as much as knowledge that will be addressed in the exam. The reference of this lecture will be mainly and principally Haifa book plus Viva book of FRCS plus passing FRCS plus a lot of things that's similar to the exam, but modulated or trimmed according to what exam needed.
Is there any other question?
Sorry, I wanted to ask, this book, can I find hard copy from library here, like Jarir or like this?
There is a copyright, Dr. Hagar. There is a copyright.
Yeah, from Jarir, maybe you will find it in Jarir bookstore.
No,
you need.
For me, I'm asking, can I find it on library here in Saudi Arabia from Jarir or any library of book for book?
It's online. It's online. I'll ask Haifa
online
to
you will
put.
have delivery, yes.
I'll ask Haifa to put the link of the book on the group, the online exchange of it. Actually, all of the candidates, either Saudi board or SFSH, are going through this book. No one in the Saudi board didn't read this book to prepare himself for the Saudi board exam, either first or second or third. But actually, it's the same for the
residency.
So it's residency, Saudi board, yeah. So it's a very nice board and very targeted book. It's not like the other textbook like Schwartz's or Film Lab or Advanced in Surgery. It's very targeted to the exam.
This webinar is recorded and it will be available in our channel YouTube soon. So if you want to go again or any other thing, you will find it soon, inshallah, in our YouTube channel. Any other question? So I have you.
Okay,
I believe thank you very much.
Thanks so much for all of the colleagues. Thanks, Dr. Mahmoud, Dr. Basim, Dr. Faisal. As always and usual, I'm enjoying your company. It was a pleasure to see your faces again. Hopefully, we can meet physically, even for once. It will be great. Thank you so much, Dr. Ahmed or Dr. Asadullah. It was extreme pleasure to having you. Your feedback about your experience in the exam and the course was such helpful for us, and they give us a lot of idea how to be more good for the next courses. And I believe it also were very good for our candidates as well to listen directly from fresh people who already have the exam soon. and thank you for the participation and putting you in an exam again with a case scenario, and you will be paid for it. I'm sure of this. Dr. Faisal will pay for you. Thanks for the all colleagues who are attended. Hopefully, inshallah, you will have a very nice, smooth exam, and you will be able to classify as a consultant in Saudi Arabia as soon as possible, inshallah. Wishing all of you all best. Praying for all of you to get your aim, as Dr. Mahmoud said. Usually focus what you need from this step. If you know exactly what you need from every step you are stepping, you will get it. It's very important.
Thank you very much. Thank you.
Someone is raising his hand.
Maybe by mistake.
Oh, he didn't.
Yeah. Thank you. Thank you.
put his hand
Thank you
down.
very much.
عايزين نشوفكم بقى طبعا فيصل، عايزين نشوفكم.
يعني لسه كنت هقول لك يا دكتور ايهاب physical meeting now is indicated. Really, we need to do some things والله, some changes والله. يعني we are here in our place which where the degree is 55 degree.
لا والله فكره، we can arrange a physical meeting في حته ميدل كده بين كل الفاكولتي، بحاجه كويسه
والله it will be very 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 nice. وان شاء الله يكون ان شاء الله physical webinar next time.
ان شاء الله
ان شاء الله يا رب. ان شاء الله
خير. نشوفكم على خير.
We really enjoyed. Thank you very much. بارك الله
ألف
فيكم.
مبروك يا دكتور احمد، والف مبروك دكتور اسد الله، ونشوفكم ان شاء الله قريب في السعوديه.
دكتور اسد الله، thank you very much. دكتور انيس also thank you very much for your esteemed presence، والعاقبه ان شاء الله لكل الحضور اللي موجودين. كل التوفيق ان شاء الله. كل التوفيق. السلام عليكم. السلام عليكم.
مع السلامه.
السلام عليكم.